Hello, welcome back on Iron's Health Talk with Dr. Akram. Today we are talking about vitamin D. This is a real hot topic at the moment, especially the COVID pandemic going around the world. There have been some evidence emerging out the benefit of the vitamin D. Thus, the path we are heading. If anybody joining the channel now, we are discussing this topic with our special guest, Dr. Suboda Thanthulage, who has had special interest in vitamin D. He's been researching for 11 years. He's got millions of papers with him. And be with us. Okay, Suboda, let's go. And okay, how does it work?
Now, earlier stage, it was known fact that vitamin D works by maintaining calcium homeostasis in the body. Homeostasis in the main, what I mean is function of calcium is managed and helped by vitamin D mostly.
Vitamin D.
Now it's a known fact. How did they found? Vitamin D was found in 1920s, but it was known for helping rickets. Rickets was diagnosed in 1645.
There was a ricket pandemic going on as well, isn't it?
Yeah, those days. But then ricket was confirmed treated by vitamin D or cod liver oil in 1920s.
So that's the time they named it vitamin D, I suppose.
So, at the time, what happened was Dr. Mellanby, who was investigating vitamin D treatment. At the time, people thought ricket was due to either unhygienic conditions, or it's something we are missing in our nutrition. So therefore, he created rickets in puppies. Now, after creating rickets and their puppies, they treated those puppies with cod liver oil to find the treatment for ricket. So from that day, they believe that this contains vital nutrition to help rickets. But subsequently,
cod liver oil, they thought it had vital.
That's correct. And subsequently, in the same time, few years down the line, they have isolated vitamin D in cod liver oil.
Excellent.
And that's where it was actually given a Nobel Prize for that.
That was a German scientist, isn't it?
That's correct. That's correct.
Exactly, yeah.
Now, that is where calcium metabolism and helping for bone health established. How it does it? Once vitamin D is activated through the kidneys, what it does is it helps our gut to absorb a lot of calcium from our food. And the second source of calcium absorption is the kidney. So it helps absorb calcium from the kidneys. As well as this calcium which was absorbed in the circulation, it helps it to be stored in the bones. And that is how it maintains calcium homeostasis.
So it improves calcium absorption in the guts and back in the kidneys, and increase the blood, the amount of calcium in the blood and
stored in
the bones.
In the bone.
And we get healthy bones.
Yeah, that's correct. Now, vitamin D is not the only one who does it, but there are so many other hormones collaborate to do this. The main function, if you have vitamin D, increase the absorption of calcium from food and through the kidneys.
Okay.
That's one of the main function. But apart from that, that is talking about the bone health. But in our cells, if you talk about nerve cells, cells in the blood, immune cells, muscle cells, liver cells, all these cells has vitamin D receptors.
Even brain?
Even in the brain. In the nerve cells, they have vitamin D receptors. If that is the case, that is why I mentioned earlier on, vitamin D main activation site is the kidney. But it doesn't have to go there to be activated. It can activate locally. Out of any of these cell sites, the vitamin D easily can go through the cell wall because it's very fat soluble. It belongs to the group of hormones called steroids. And it can dissolve and go through the cell and change into activated form and act upon the inside the cell receptors. By doing so, it increases the function of the cell.
Function of the cell.
Now, it depends on what cell it is acting upon. Now, we'll argument's sake, we'll say immune function. Now, these days, as you mentioned, there's a lot of talks going on the immunity because of the COVID-19. Now, what we have in immune systems, broadly we can classify it as innate immune system.
Innate immune system.
Which we born with.
Okay.
And then adaptive immune system, what we gain and accumulate during our lifetime.
So adaptive is we acquire it over the life.
Over the life.
Okay.
And that system is going to act upon any infection specifically. For example, measles. Something like that, you learn, the system learn and act upon a specific, it takes a specific role.
So it attacks the specific targets.
That's correct. Now, what vitamin D does is, it improves the function of the innate immune system and control the adaptive immune system.
Okay, so
by doing so,
helps in both.
It helps both ways. One of the main problem is COVID-19 is overreacting of immune system. That means overly reacting immune system producing large amount of inflammatory mediators. That outcome could be controlled by vitamin D. One aspect, it improves the function of these innate immune cells, and the other aspect is control the immune response by reducing inflammation.
Are there any studies about this?
There is one study. Basically, they have checked vitamin D levels were in COVID patients. This is the paper I just photocopied from a couple of pages. Now it is coming from Philippines. When you talk about Philippines is close to equator. It's a sunny country, and they have investigated vitamin D on COVID-19 patients.
So in Philippines, they investigated vitamin D on
levels
patients.
On COVID-19 patients.
Okay.
Now, what they found was, this is not a peer-reviewed paper, but it was published in April. But in fact, what it shows is, on the investigation of vitamin D, they classified their COVID patient out of 212, mild, ordinary, severe, and critical. So critical means patients who needed ventilation.
Ventilation, okay.
And severe means they have respiratory dysfunction.
Yeah.
They are not still on the ventilator, but they have breathing difficulties. Now, if you look at those two groups, which is severe form of COVID-19, out of about 114 patients, there's only 4 patients has normal vitamin D levels. But whereas a mild form, they had only 2 patients had low vitamin D.
So in the mild form, so people who had normal vitamin D, they had mild
More
infection.
patients, almost all the patients who had mild disease had normal vitamin D. And the patient who had severe form, almost everybody was low in vitamin D.
Everybody was low in vitamin D. Then this is in Philippines where they get sunlight every day.
That's correct. If that is the case, we tend to have low vitamin D here anyway. Now, this is not a peer-reviewed paper. It is not a randomized controlled trial.
But this is a starting point, isn't it?
This is showing something that we can be low in vitamin D.
Okay.
And we could criticize this paper left to right, but it shows some clues.
Some clue.
And gives a little bit of direction whether we can start.
Where to investigate it.
That's correct.
Okay. What are the benefits of vitamin D?
Now, one benefit we talk about the bone metabolism.
Yeah, we talk about calcium.
The other one is the immune response.
Immunity we talked already, yeah.
And then if you talk about, now we'll talk about blood pressure. If you look at the blood pressure, I'm talking these couple of 3 topics. The blood pressure, because if you take vitamin D, the blood pressure control will become easier. Or it will become, controlling will become more possible or
more
easy.
Adequate, more
that's
possible.
Correct.
Yeah, that's right.
Now, how it does is, it affects on renin-angiotensin system, and therefore they reduce the release of renin secretion and also aldosterone.
And these are the hormones, I suppose, which increase the blood pressure.
They are into some level responsible for high blood pressure. Not every case.
Not every.
But there is some responsibility for these hormones to elevate blood pressure. Not only that, it has also shown vitamin D in the endothelium, where
the vessel walls. It increased the nitric oxide secretion. What is nitric oxide? This is a special chemical which synthesizes in the cells, and what it does is it relaxes the smooth muscles, therefore dilates the blood vessels. So dilates the blood vessels.
So by doing so, it will help and help managing the blood pressure easier.
So blood pressure is well managed with vitamin D. What about cancer?
Now, if you think about the cancer, now what vitamin D does is vitamin D stop and control cell division. So one of the main cardinal signs of cancer is fast division of the cells.
Cells multiply faster, quicker.
When this process being suppressed
down.
by vitamin D3, therefore development and spread of vitamin D will be slowed down. Not only that, and it increased the environment for our normal immune cells to function appropriately to act upon these cancer cells.
Exactly.
And also, when this happens, we call cell death. When in the cancer process, normal cell can also die. And that normal cell death will be prevented by having normal amount of cancer. So when you think about the cancer, it stops development of cancer, and it increases the immune function against cancer, and also it helps our normal cells not to die. So therefore it helps. If you have vitamin D, it helps on various aspects to improve the cancer outcome.
I saw a paper, I think I was reading about vitamin D, and I saw this is a study, I think, done in America. People with prostate cancer, where they came for scanning and they scanned them, and afterward they had to wait for some time because the tumor was not that enough to do something. So now they have given them certain amount of vitamin D, then sent them home back, and by the time they came back after a year or 6 months, those tumors were shrunk.
It could be true. I haven't seen that particular paper, but it has proven beneficial effect in colorectal cancer.
Colorectal cancer.
And also it is known the fact that if you have a skin cancer, if you have a normal vitamin D, your life expectancy will be longer.
Okay, we are running out of time. Let's quickly talk about diabetes. And
now, to sum up, because we can touch into our ethnic minority group, normally all of them are normally says about they are overweight, diabetes and high blood pressure. Now, if you think about the diabetes, it increases the peripheral tissue sensitivity to insulin. And then also, especially type 2 diabetes, it increases the insulin secretion by leftover cells in your pancreatic gland.
So increase the secretion, and it increase the uptake of glucose
peripheral tissues.
From peripheral tissues.
By doing so, your insulin resistant form of diabetes might become easily controllable. So therefore, having vitamin D in that respect, it also helps. But when you talk about overweight per se will not affect with vitamin D. But if you think about vitamin D helps with the depression, improves the mood, improves all cellular function. Person who is obese may feel well. So by having that
that good high, they feel good.
Having advantage of improved quality of life, you might be able to do some exercise to get rid of weight.
They might go to a pub and get dancing.
Correct. And if you think about these ethnic minority groups, one of the cardinal signs why they are dying, or why they are having more COVID-19,
yes, and
get respiratory failure and death. One of few things they elaborate is high blood pressure, diabetes, and overweight, and also the job they do. Now, if you think about the vitamin D helps with overweight, and vitamin D helps with diabetes, and vitamin D helps with blood pressure.
So it helps in every aspect.
That's correct. Now, if you think about this, even without thinking about respiratory failure and COVID-19, by taking them, you improve your comorbid disease. Therefore, by taking it, is extremely advisable and helpful.
This is vitamin D, which I take, which is 4,000 units. Which I bought it on Amazon. It's not very expensive, I think about 10-15 pounds. Okay, how much vitamin D should we take?
Now, it is an extreme complicated question to answer. Now, first of all, I would like to stress vitamin D levels are varying in all over the world. There is no standard guidance on vitamin D levels.
So shall we make it simple and follow one guidance, or not?
So I myself, all my patients explain endocrine society guidelines. What it says, vitamin D measurement comes in either nanomoles or microgram. If it is nanomoles, it says 75 and above, which normal, 74 and below, insufficient. But up to 50 is the insufficient, below 50 nanomoles per liter is deficient.
Deficient, okay.
But if it goes below 30, it is severely deficient.
So when do you advise to start taking?
Now, my advice, if I see patients' vitamin D levels less than 125, 130, I always recommend them to take vitamin D. Now, if you think about vitamin D, the most of the range, even endocrine society does not give a right upper range, but usually said you can go up to 250 without seeing any side effects. In fact, you can take large amount vitamin D short courses without producing any side effects such as...
Who are the people who got a huge amount of vitamin D in their body?
Now, usually people involved in sunny activities. Usually these are beach boys or people who work at beach, and also people who work outside.
Outside.
In summertime. In European countries, if you see workers outside in the garden, if they expose their skin, at the peak of summer and the end of the summer, they can generate enough vitamin D or large amount of vitamin D.
That's for the 6 months, yeah?
Roughly about 3 months.
3 months, okay.
But rest of the year, it gradually goes down.
What about our ancestors who have been roaming
now,
around?
There are reports says vitamin D always been higher than today's levels.
Today's level.
So it could be more than 150, around 200 levels. But keeping around 125 and 130 will be helpful on many diseases. If you really want to see a lot of information, there is a website called grassroothealthresearch.com.
Grassroothealthresearch.com.
If you put grassroot health research, it will come on your Google. Then you can read. It gives a lot of graphs, a lot of indications when and what to take vitamin D.
Okay, how much generally, a general person, how much they should take?
Now, it's again, any person, if you have a 60 to 70 kilogram, if you're taking appropriate amount of water, appropriate amount, what I mean is at least 1.5 liters or more, you can take 1 to 3,000 units without even hesitation.
So up to 3,000 units vitamin D without any hesitation.
Now, but there is a lot of but. Now, if you can think about 70 kilogram person. Now, this 70 kilogram person, if it is 4 foot tall, that means he or she contains loads of fat, and BMI could be very high. Now, that person, this 3,000 unit may be not enough. Whereas normal patients with normal height, BMI less than 25, that dose may be appropriate.
So that body mass index is a bit I think it's a normal fit person, is that right?
It's a normal person. But on the other hand, we'll say if you're a 100 kilogram man with a big posture, but BMI is still within normal range,
okay,
that 3,000 is not good enough.
Okay.
Therefore, it's always advisable, I repeat, advisable to test the vitamin D and take vitamin D appropriate.
Okay, for example, how much should I take in general? If you don't know anything about me and just say, look at
you
me.
can take 3,000 units.
So I can take 3,000 units
as far as you drink water.
So if I have a bit more fat in me, maybe I'll take probably 4,000 or 5,000, is that right?
That's correct.
Okay, and are there any way we can check our
vitamin D, I personally check from Birmingham. Vitamin D, you can ask your GP to check if you have symptoms. Now, extreme form of vitamin D deficiency, you may find proximal muscle weakness. What does that mean? When you're sitting and standing, you may find very difficult to stand up. But this type of patients are normally elderly adult people, or you may find muscle weakness. And when you come to the other extreme, younger generation, you may find aches and pain, bone pain, muscle pain. And also, this is a common explanation as growing pain on growing children. Now, for example,
so even for growing pain,
could be a reason for vitamin D deficiency.
Vitamin C deficiency.
And when you have that symptoms, you should check vitamin D. For basically, if you have a muscle pain, bone pain, weakness, and also if you feel depressed, those are the cardinal signs of low vitamin D. And also, if extreme cases,
3 minutes left.
Extreme cases like rickets, these days very rare.
Very rare, yeah.
But that case, obviously, we have to check vitamin D. If you have any of those signs, you can ask your GP to check vitamin D
Ask
levels.
your GP.
But otherwise, if you would like to keep your vitamin D level checked regularly, you can go to website, Google Birmingham City Hospital, and they when you call them, obviously they charge you, and they will send a little packet with blotting paper on it with the little needle. You can take a prick test and put 4 drops of blood on
Excellent.
that and post it to them. They will send the level done.
And if you have realized, we have played that slide on my introduction. If you go back on your Facebook Live, and you could take a snapshot, and you could keep that website saved. Okay,
and I also,
quickly,
before I finish,
is more vitamin D harmful?
That is exactly the question I want to address. Now, this is the thing.
2 moments.
Now, they explain many papers wherever you read, it says hypercalcemia and kidney stone. In my practice for last 11 years, I have seen only one patient who has parathyroid gland cancer, therefore it's not relevant to vitamin D. And the other thing is, common symptoms, what I say, is gastric bloating. You feel like gastritis or discomfort. To prevent that, only answer is drink enough water, and also you should take magnesium.
Magnesium, yeah, here we go. That's calcium, magnesium, what else? Zinc and vitamin D3. But this vitamin D3 is not enough, I think. Here we go.
Now, why magnesium? Magnesium is very important in cellular metabolism.
Magnesium is very important. Okay.
And it is involved in every single step on vitamin D metabolism. And also it is act against calcium, and therefore it will prevent some of the symptoms. Next to gastric bloating, next common patient complaint is a headache. If you have gastric bloating or headache, number 1, you take your magnesium and vitamin D. Number 2, drink enough water. Number 4, you come down your vitamin D intake. For example, if you start taking 3,000 units, you start getting headache. What you do is you come down to 1,000 units and then build up your level slowly.
How much magnesium?
Magnesium, usually I recommend any person can take up to 500 milligram.
500 milligram daily? Per day.
But magnesium absorbed from the gut. If you drink or take magnesium more than enough, if your body has enough magnesium, body will not absorb, it pass through the bowel.
It passes through
and
the bowel.
If you have more magnesium, it improve your bowel or the consistency of your bowel. Therefore, you have a soft stool.
Okay.
Therefore, it is have an advantage. And also, by checking magnesium in blood, it will not reflect how much magnesium in total. Therefore, asking your GP or someone else to check magnesium, it will not reflect.
I have a few special suggestions and questions, because this all related to COVID. These are from a few newspapers I gathered. Black people 4 times more likely to die from COVID-19. This is the Guardian, 7th May 2020. And there is another one. Coronavirus. Black Britons face twice the risk of death. BBC, 7th May 2020. And why are more people dying from BAME community dying of COVID-19? That's BBC, 7th May 2020.
Now, we already elaborated and touched all these questions. That's why on the same article, when you keep reading down, it says risk factors, which is hypertension, diabetes, overweight, and the type of work they do. And also, they are highly likely to be low in vitamin D.
Low in vitamin D.
But if you take vitamin D, I stress it's not a magic bullet. It is one of many hormones which help us to be better and improve our quality of life, in combination of many of the factors which we need to have in our life. So nutrition is a must and very important. If you have appropriate vitamin D, you may catch COVID, but you may not develop respiratory failure.
You may not have the bad symptoms and signs.
You may not die because people die in COVID-19 due to overactivity of your immune system and due to respiratory failure associated other symptoms. And now, one of the many reasons why they can go to respiratory failure, they know there are so many complications. But at any point when you start, you may get benefit of vitamin D. Therefore, I recommend them to take appropriate amount of vitamin D. It will help you to not to fall into category of severe sickness.
Okay. So even people with black skin, I have lots of people at work as well, they keep asking me about this. They should be able to take similar amount, 3,000, 4,000
Now,
units,
it depends on the size and the body weight and the BMI.
Again, yeah.
And also I
September.
recommend, there are lots of researchers, even by taking 10 to 20,000 for a few months, it will not produce side effect. Usually if you're a normal 70 kilogram man,
That's
as
per
I
day
said,
or week.
3,000 unit you can take a day. If you get infection, you can double the amount what you take
If you get
until you
infection.
get better. But
And
to
growing children,
growing children, ideally you should check and supplement vitamin D enough, because by supplementing, depending on how low you were,
Yeah.
it takes time to improve your vitamin D resources. If you are extremely low,
Okay.
by taking 1,000, 3,000 units, it's like
Suboda,
a drop in the sand.
Thank you very much. It
No
is
problem.
amazing. I think it was a great talk. I really enjoyed it. Vitamin D. Thank you very much for being with us.
Thank you very much for
All right.
inviting me. Thank you, Akram.
Thank you. Today we've been talking about this, vitamin D3, vitamin D. Basically it comes from sun, but we don't stay enough in the sun, so that's not enough. So we were talking that we could always supplement with pills if it's necessary, or you can always lie down in the sun for hours, 2 hours, 3 hours and catch enough vitamin D. Please look after yourself, especially with this COVID-19 going around. Boost your immune system, boost everything you need to protect this nasty infection. So it was amazing to talk to you guys, and I'll see you in a similar program. Until then, please look after yourself and take advice, or look at the websites and maybe start taking vitamin D. See you next time. Thank you very much.